Hello. This month's case is a 46-year-old male patient. He has no previous history, significant medical history, and he presents to the emergency ward with stomachache, nausea, vomiting, and a severe headache. He says that it started following a football game where he severely exerted himself, and 3 to 4 hours later he had stomachache, nausea, and vomiting. In the emergency ward, all kinds of food intoxication, drugs, and other toxic agents he might have used or he might have come across with are ruled out. And he's hydrated, but despite hydration, his creatinine levels increased from 4.7 to all the way up to 10 milligrams per deciliter, where at which point they decide to take a renal biopsy. And this is the renal biopsy of the patient. At low magnification, we can immediately recognize that there's tubular injury here. You can see that the tubules, some of them are very swollen. Let's move closer, with vacuolated cytoplasms. And some of the epithelial cells have actually denuded into the lumen. You can see that they're very swollen. Whereas other tubules, the epithelial is thinner, the lumen is wider. You can make out the nuclear enlargement and hyperchromasia. They look simplified, these tubular epithelial cells, as you can see here. And closer inspection, we can actually make out these eosinophilic inclusion-like material within the lumen. I'll show you better ones. And within the cytoplasm of the epithelial cells. Look, this one actually looks kind of crystalline and rhomboid in shape. You've got these look like they're within the cytoplasm of the proximal tubular epithelial cells. And when you move forward, you can actually make out more of these inclusion-like crystalline or rhomboid-shaped structures within the epithelial cells. Some of them are much smaller, some of them are much larger with angulated contours or more globoid shape, whereas some of them are more needle-like or rhomboid in shape, more crystalline, we can say, in structure. The glomerulus looks perfectly normal. There's no endocapillary proliferation. There's no thickening of the basement membranes. But what is prominent is these structures, as you can see, these crystalline structures within the tubular epithelial cells. There are actually all kinds of sizes and shapes. You can see some of them are much more smaller and granular, whereas others have formed these crystal-like structures. Some of them are much bigger and like casts within the lumen. They've been cast within the lumen. You can make out the degenerative and regenerative changes within the tubular epithelial cells. That these tubules are acutely damaged. There's acute tubular injury with granular casts, and within these casts and within the tubular epithelial cells, you can identify crystalline inclusion-like material. Especially when I've moved the micrometer here, you can make them out even better. See, there's a very big one over here, a crystalline one over here. And some of these epithelial cells are actually stuffed with these crystals. Over here you can make them out again. They're filled with these crystals. The Jones Metamin silver stain highlights these crystals. This is it. When we move closer, you can easily make them out as parts of these granular casts within the lumens, as well as the cytoplasm of the proximal tubular epithelial cells. You can see that there are all kinds of shapes. Some of them are more rhomboid and needle-like, others are more hexagonal, if you may say, with angulated contours, or more globoid. Here's another cell. The tubule epithelial cells, as you can see, of this proximal tubule are actually clumped and stuffed with these structures. And here you can see them within the lumen of a distal tubule. And here again within the proximal tubular epithelial cells themselves. And this is the PAM stain, which again is very good at highlighting these structures. Here you can see them as tubular casts. Here you can see them as globoid structures. And you can also see them as needle-like structures within the epithelial cells, as here, and like here, and here. And again, the glomeruli are fairly normal. When we look at the immunofluorescence of this patient, we see that these crystalline structures are actually light chains, and they're monotypical light chains that stain for kappa and do not stain for lambda, as you can see over here. This is the kappa stain. You can see the tubular epithelial cells and the granular casts within the tubule staining positively for kappa, and this is lambda. And again, this is the kappa stain, and this is the lambda stain. We performed immunohistochemistry as well, which also highlights that these cells and the light chains crystals within the tubular epithelial cells and the luminal casts stain negatively for lambda. This is the lambda stain. You can see they're negative with lambda. And the proximal epithelial cells stain intensely with the kappa stain. And in fact, not only is there a much more smaller diffuse granular staining within the cells, but you can also make out the more crystalline structures within, as you can see over here with the kappa stain, as well as the much more smaller granular inclusions, light chain crystals within the tubular epithelial cells. So the patient was diagnosed with light chain proximal tubulopathy with crystals, kappa light chain. He was positive for kappa light chain, and of course afterwards he had to have a bone marrow biopsy. And this is the bone marrow aspirate of the patient. As you can see over here, I'm gonna delve in closer. This patient has sheets of plasma cells infiltrating the bone marrow space. Here they are. You can see that they're some of them have prominent nucleoli, and they're atypical, and they're sheets here of atypical plasma cells infiltrating the bone marrow. Immunohistochemistry revealed that these plasma cells were also positive with kappa and negative with lambda, and thereafter the patient was diagnosed with multiple myeloma.